now proposes something like $250 billion in Medicare cuts. It's staggering. It's a reduction of nearly a quarter in Medicare services by the year 2002. We learn a lot over time. All of us do here. We learn about the issues. I hope that apparently the senator from Montana didn't learn much, because he was deeply concerned 14 years ago about very small savings in Medicare. Now he wants to spend $2.5 trillion, taking $483 billion out of Medicare to create a new entitlement system.
Might I respond to the senator? Might I respond to the senator from Arizona?
The senator from Tennessee has the floor.
I'm happy to see a debate actually break out on the Senate floor on this issue, and as long as it's on Democratic time.
Here's your chance.
As long as it's on Democratic time, that's fine.
Well, it's on both sides. It's both sides. It's both sides. You have even time.
Okay. No. Whatever time you use should be on Democratic.
Correct. Well, the basic question here is obviously how to protect Medicare benefits. That's the basic question. I think most of us would agree. How do we protect Medicare benefits, and how do we extend the solvency of the Medicare trust fund? I think that's the basic question. And I think we'd all agree that, that excessive payments to providers would cause the insolvency of the trust fund to come earlier rather than later. I think we all agree with that proposition. Next question is, what would excessive payments to providers be? Do providers get paid excessively? And I think that's an honest question we should ask ourselves in a way to help extend the solvency of the Medicare Trust Fund. And in fact, in 1995, many senators, especially on your side of the aisle, did say just that we've got to cut Medicare in order to save benefits. That was made by many senators. I've got them right here in front of me if anybody wants to hear them. I'm not going to go through all that, but it's the truth. And that's exactly what we're doing here in this bill. We're trying to help extend the insolvency, or the solvency of the Medicare Trust Fund by cutting down on excessive provider payments to Medicare Trust Fund. And how do we decide whether payments are excessive or not? That's really that's the basic question here. And all we can do is just give it our best shot, just make our best judgment. And we have to, I think it makes sense to look at the recommendations by outside independent groups, what they think. And one is MedPAC, the Medicare Advisory Commission. And that's an outside group, as we all know, advises Congress on Medicare payments, because, we're not, as members of Congress, totally competent to know exactly what dollars should go to which industry group. I mean, we got too many other obligations here to think about. But we have to, but we must be responsible as senators and do the best we can. Well, MedPAC has said these groups have been overpaid, and Wall Street analysts tend to agree. In fact, MedPAC said with respect to Medicare Advantage that they've been overpaid, forgotten the exact amount, but by much less than the $18 billion reduction in this bill. In fact, I totaled up and looked at the growth rate, the projected growth rate of providers, hospitals, nursing homes, home health, hospice, pharma, you name it, and on average, the growth rate is over that decade is going to be 6.5%. That's the growth rate of providers. And we decided to trim that a little bit. We decided to trim that down to by 1.5%, so it's a net of 5%. So it's a 5% growth rate for all the industries here in an attempt to try to find the right levels of reimbursement to providers, which, with that trim, will also help extend the solvency of the Medicare Trust Fund. And when we talk to providers, they basically agree with those cuts. They basically agree. Why do they basically agree? They basically agree because they know that with much more coverage, with many more people having health insurance, they can spread out, their business. But they may lose a little on margin, they can pick up on volume. And that's exactly what their business plan is under this bill. Wall Street analysts say, and I quote them, says, these industries are doing great. They're doing well under this bill. They're not getting hurt. So we do achieve a win-win. I don't like that phrase, win-win, but I'll use it here. where the solvency of the trust fund is being extended, and where the reimbursement rates to providers is fair, not being hurt. It's fair, and that's why they want this bill, by and large. Most groups tend to want this bill enacted because they know that it's good for the country, it's good for seniors, and it's good for them too.
We have a...
Mr. President, could I just mention again, $70 billion with fraud, abuse, and waste. You could, and Senator Coburn, the doctor, can tell you, there's nowhere in this bill. And the fact is, maybe some of the providers have been bought off and jawbone and had their arms twisted or given a good deal like pharma has, but the recipients haven't. Recipients out there, the Medicare recipients, know that you can't cut $483 billion without ultimately affecting their benefits, and that's a fact. And again, conspicuous by its absence, I say to the senator from Montana, totally conspicuous by its absence is any meaningful malpractice reform, which has been proven in the state of Texas and other states to reduce costs, to increase the supply of physicians and caregivers, and there's nothing in this bill that's meaningful about medical malpractice reform. I had a town hall meeting with doctors in my state, and every one of them stood up and said, I practice defensive medicine because I fear of being sued. So if you're really serious, I say to the senator from Montana, if you're really serious about this, medical malpractice should be a key and integral part of it. Even the CBO costs it out about $54 billion a year, and when you count in all the defensive medicine, it could be as much as $200 billion over 10 years. That's conspicuous by its absence. I think it brings into question the dedication of really reducing health care costs across America.
We've enjoyed our discussion with the distinguished chairman of the Finance Committee and thank him for his questions. But Senator Coburn, who is a physician, the senator from Montana, has talked about doctors being overpaid. He talked about...
No, I did not. All due respect, I did not say that.
Did not hear the words providers overpaid?
I talked about hospitals and others. I did not.
Well, aren't physicians providers?
In fact, if I might say to my good friend from Tennessee, this legislation pays more to the primary care doctors, as it should. 10% increase in Medicare reimbursement for each of the next 5 years.
Well, perhaps...
And I did not use the word doctors.
Well, providers, Mr. President, I must have misunderstood, because normally when we talk about providers, we talk about hospitals and physicians. But we have a physician on the Senate floor, the senator from Oklahoma, and I wonder if he, having heard this debate, might want to comment. And I might say, isn't it true that the McCain amendment, which we have on the floor, would send this back to the Finance Committee and say, if there are savings, let's spend it on Medicare to actually strengthen it?
Well, I thank the senator. The first comment I would have is relying on what a Wall Street analyst says today. They have about this much credibility in this country today. Look at the economic situation we find ourselves in because of what Wall Street analysts have said. That's the first point I would make. The second point is the majority whip yesterday said we should not cut Medicare. We should cut Medicare Advantage because of the 14%. Senator Dodd just recently went after the Patients' Choice Act because we actually make it be competitively bid without any reduction in benefits. Your bill, for every Medicare Advantage, cuts 50% of the benefits out. It cuts the benefits. And so the difference is, and I agree with the majority whip, we do need to have the savings in Medicare Advantage. But the way you get that is through competitively bidding it, at the same time maintaining the requirements for the benefits that are offered. There's a big difference in those two. Ours ends up being pure savings to save Medicare. The savings in this bill are to create a new entitlement. The other point I'd make, if you're a senior out there listening, and if you're going to be subject to the new increase in Medicare tax, for the first time in history, we're going to take Medicare taxes and not use